has to be switched lengthwise. Okay? I'm going to switch
For
this out
Y
real
view.
quick. Okay. All right. So for demonstration purposes, I'm going to end up showing this one, his right one. But when you are setting your patient up to make sure you get the correct shoulder, I usually leave my hand lightly on here when you're first learning the lay of the land, so you don't get the opposite shoulder. So it's like, I'm gonna have you come ahead and turn towards me. I would literally have him come put his shoulder against there like that, okay? But I'm gonna show you the right, okay? That way it's a little bit easier to see. All right, bring this up here, okay? And bring that arm down. All right, so this here ends up touching here, okay? So I have him put his shoulder against. Don't have him leaning, because I don't really need the humeral head touching. Yes, you do have some OID, that's okay. All right, so to get him lined up, he's got a great border too, jeez. All right, so I'm gonna switch my collimation to match my cassette. There we go. All right, so I find scapular border, okay? I need to make sure, again, I'm looking for Y. So this one here is my little hand trick I use. So I find scapular border, come down, inferior border is right here. So right here, inferior angle fits right into the groove of the hand, okay? So here, I'm gonna actually rotate him up, okay? This is letting me know that he's straight now, okay? I should actually have a very nice, it's the only thing different now, I'm gonna have him come forward just a smidge, because you want this to traverse the scapular border, okay? And you can actually feel, let your patient know it, don't just do this to your patient without telling them what you're doing.
Push harder.
Just let them know, okay. So the other thing too, I have a little bit of extra late field. I can actually come down just a little bit on this one. So I'm gonna come down a little. Bring this here. Okay. And I can still see, I'm actually good, okay. So I'm gonna take my marker go? There we go. Pop that right in your field. The other thing too you can do a little bit to make sure you can collimate side to side a little bit. I usually just go right to my border, still have my everything in there, okay? So, again, if you're ever, again, if I needed to, actually, there we go. So, and it's weird because right now, I can look at him and if I'm not too far from having him in a lateral position, he's closer to 60, okay? So, his MCP. But this little deal, scapular border, give me a scapula, Carly. Yeah. So, it's literally, would be sitting on him like that. This, I'm literally just like this. Okay? So that's what I'm doing. I'm literally fitting it right in there. And this lets me know, it's kind of wagging my hand, how straight he is if I need to. If this is slightly angled, I see more of the body here that I don't need to see. So I'm not in a true Y. I want it just like that. Okay? All right. That would be the Y view. I am going to show you the AP. For checkoff purposes, you got to be able to do this one. Okay? All right. Turn around for me. Nobody called it. I put the wrong marker up there.
Oh, I did.
I thought you were simulating. You're saying just for this purpose? Or for this?
Even if I'm simulating, I should still put the correct marker up. So, all right, so if we're doing AP, we're gonna go back to left. So this one here, if the patient can, most patients are gonna be pretty, and if they can bring the arm up, ask him, how far can you bring this arm up here, sir? No, it's fine, it's fine, you can be difficult, I don't care. As soon as he does that, I can actually take my hand along his scapula right now. I can feel it pop out just a little, which is great, All right, so from here, so you're gonna have him obliqued again. This comes up towards the tube. I have a lot of OID. It's another reason I only do these portable. And I'm willing to bet some of your techs, because again, in digital, majority of the main cassette we have is a 14 by 17. They have this collimated wide the heck open, so they make sure they get it. So from here, okay, humeral head facing the tube. I can feel scapular border. I'm just going reverse at this point. I can find his border here. I'm actually lined up pretty well. I can still see that. Okay. I'm gonna pop my marker in my field. That would be for AP. Okay. These again, predominantly portable, but again, a lot of your people, some of your techs find these easier to do. Personally, I like doing PA. So
Some places like to do AP just because for portables they're going to be doing AP anyways.
yeah, yeah, and it's one of those. It's like I know I do them portable, but I prefer to do the PA. And you actually get a prettier Y in a PA. That's just me. All right, so that is your external, internal, gray sheet, and Y view for your shoulder. Okay.